Hospice, it is a philosophy. It's not a place. It's not a structure. It's a care that addresses not only the physical needs of a patient, but also the psychosocial and spiritual needs of the patient.
We're a nonprofit. We insist on staying a nonprofit. We answer to our community. Our community tells us and dictates us what they want.
We send in chaplains, nurses, social workers, volunteers to help bring calm and peace to the mind, to help them to focus their thoughts on things above, not on things of the earth.
That was the goal of hospice when it first started many years ago. I think that's the goal now, is to try to ease that transition.
The job that I have encompasses a lot of different areas, and end-of-life care is one of them. And I know from a personal standpoint what a difference it makes to have good end-of-life care.
A study was done by the National Hospice Association that shows hospice patients, if they start getting that care early, have 29 more days on average than a patient who doesn't have hospice. Getting a referral early doesn't mean it's a death sentence. It means that it's a life sentence.
Every extra day that you have is an extra day that you have to have conversations with loved ones to tell them that you love them. And one day is a very important amount of time. I tried very hard to get my father and my mother to get hospice in earlier, but my mother looked at it as giving up on my father. I think my father looked at it as giving up a little bit, and so neither one of them wanted to disappoint the other with that. So when I finally convinced them to get hospice in, they both were very pleasantly surprised. It gave them the support that they needed, but it also let me not have to be an oncology nurse at that time and be my father's daughter.
When it was my husband, I thought I could take care of him better than anybody. I was reluctant to accept it then. What they did for him made it easier for me.
I am so passionate about talking about the experience my father had, because I don't have any what ifs with them. I got to say everything to my dad that I wanted to say. And it was sad when he died. There was tears. But now, when I think about it, it's tears of happiness that I don't have those what ifs, because we had hospice.
My son came into my father's room and said to my father, "Grandpa, I just want you to know that if it wasn't for you, I wouldn't be half the man that I am today." So those kinds of very important conversations take place in the intimacy of a home, where they don't take place a lot of times in a hospital. He died very peacefully with all of us around him. Because of the way he died, I can look back on my father's death, and I cried when he died. Did I want to leave him at that time? No. But everyone has to go sometime. I have not cried one day since his funeral in thinking back about my father's death, because I know that we did everything right. Hospice helped us to do everything that we could possibly do for him at the end of his life. And it gives us such comfort to know that he was where he wanted to be when he died.
The night before he passed, I had him put the bed up against my bed so that when I laid down I could hold his hand. And we sang hymns, and his daughter read scripture, and he just seemed to be so at peace. In the morning, I could tell the end was very near. I could still tell him I loved him, and I know he heard because he held my hand tighter.
The other benefit that my mother didn't count on from hospice was the follow-up care that she got. Spiritually, she was so well supported, and she was able to say things to them that perhaps she didn't want to say to her own family members.
When you work in hospice, you become part of these families. You hear their stories, you experience their pain. you shed tears with them.
Hospice care helps people to understand that the Lord is with them, that we're with you, that you're surrounded by people who care about you, and we're going to see you through this.
I was very grateful for everything that hospice had done for us. And I don't know how we'd have got through it without their help.
For me, hospice has been one of the most meaningful and one of the most intimate things that I could ever possibly be involved with. The patients have reached out, they have touched my heart. They have made me realize that life is good.
We're here to serve God. We're here to help people. And it's refreshing to be on a team like that. You know, it's not about the money, it's about ministry.
We're invested in our communities. We're invested in these friendships and family.
Every interaction we have in our life as human beings, I feel like changes you a little bit.
They're going to treat your family member like it's their family member.
My mother to this day says it's the best thing that they did.
Hospice really does give forth a sense of hope to people.
They say that when life is brought into this world, it's a very intimate moment. You have a mother, a father, and you have a child, and they are surrounded by family, and they are surrounded by relatives, and life is good. It can be just as intimate when someone is leaving this world.
I couldn't say enough. They were like angels that came into the house.
Hospice care touches people when they need help the most.
Hospice equals hope. Hospice is embracing life and living each day to its fullest.